During the Luminary, the new edition of their UNESCO-MERCK Africa Research Summit, MARS 2019, in partnership with African Union in Accra, Ghana, was conducted with the aim to contribute to building research capacity in African research community and discuss challenges, opportunities, and proposed strategies to support health decision-making that address health and sustainability challenges in low and middle-income countries. The end objective is to empower African young researchers and women researchers, advancing their research capacity and promote their contribution to STEM.
We are aware about the Agenda 2063, where the Agenda 2063 aspiration told us that Africa needs to be prosperous and Africa needs to develop itself by relying on its own people. So, this has resulted on several strategies and action plans set in place on the level of the Union and I believe in the level of member states. This TISA 2024 call upon Africa to change from commodity-based into knowledge-based economy. This is triggered when I was preparing to this session to read more and more, and I find myself to ask you, distinguished ministers, colleagues around the table, how this landscape can change the research impact in the communities and overall health and well-being of African people.
We have set up the Zambia National Health Research Authority in order to coordinate research in the country. This authority works with other sectors to look at the ethical basis of research and also to ensure that there is adequate coordination on any research that is based on humans. We find that this works better in resource mobilization. Furthermore, we've partnered with organizations, we're partnering with MERCK in order to promote research, and we believe that a coalition for research needs to be built for us to adduce evidence to inform human development.
I want to also note that research and innovation are very important components in improving the lives of our people. And of course, Uganda as a country does promote research, does promote innovations. However, our biggest challenge has been how to scale up these innovations by the young people. We need to find means and ways of actually putting these innovations to use, scaling up some of these innovations. We have very wonderful new, using ICT technology information, using the phones, various innovations, for instance, for the sickle cell detection, TB, and all that, but these remain on the shelves. So I'm glad that we have MERCK, which is the oldest pharmaceutical company. It would be important that some of these young innovators are not frustrated and these innovations are not taken away from them.
When you get the young doctors graduate from medical school, how many go into research? Very few, because they would rather go and specialize, do residency, and be a surgeon or gynecologist than go into the labs. Because when they become the surgeon or gynecologist, they are paid more. How many will rather finish medical school and go and do a master's and a PhD in physiology and biochemistry to go to the basic sciences to teach? Fewer people, because the surgeon gets paid more, the gynecologist gets paid more. So they have to be balanced so that people will know wherever you go, there is a benefit.
What we need to do is, in terms of training also, which is linked to the research which I was talking about. We've got our own virtual universities, like the COCEXA, which is based in East Africa. We want to see working relationship being developed between MERCK and COCEXA, which allows students to be trained within country for all these particular exercises. We want to see the Egyptians sending in their lecturers to come and train in the various centers, right? Besides having to go to Egypt, right? The initial, yes, but as they have trained more, we want them to come to our countries. We want to be able to build a workforce within our country, and they will carry out the research. We want the Indians to come to our country, and be able to support us locally, and be able to train our personnel.
So as governments, first of all, what we have to do is to make sure that we clean up our systems where that can then, develop confidence from the various partners who in turn will then begin to channel the resources through government systems as opposed to using NGOs who themselves are not as accountable as we would want to believe. So I thought I wanted to share with you, our colleagues, that first of all, let us be sure that we are as transparent as possible in the manner we manage our partners who put in lots of resources in our system that will then be used for research. I thank you very much.
Imaginez avec cette technologie, s'il n'y a pas une langue qui nous unit et qui nous permet d'avancer, comment la recherche peut avancer? Au mécanisme africain, j'ai été jusqu'à vice-président et président avant d'aller. Tout ce qui s'est dit en anglais est traduit en français, en portugais et bientôt en arabe et en swahili. Tant qu'il n'y a pas une langue qui nous unit, le sommet est malade. Et il faut chercher des solutions.
Alors, comme solution, c'est de pouvoir développer le système que MERCK a commencé, Fondation MERCK, parce que la formation sur le terrain, mon collègue du Zimbabwe l'a dit avec EcoSEXA, il y a la région East Africa et South Africa qui a commencé à ce que les médecins qui sont dans les districts sanitaires puissent être formés sur place. Alors cela pourra éviter à ce que nous envoyons aux États-Unis, en Europe, ne puisse pas rester. Donc, il est dans un hôpital de district, il est médecin généraliste, il peut développer des capacités de chirurgie sur place et obtenir un diplôme d'une manière efficace, et cela implique la collaboration entre les pays africains.
As Africa, we need to focus so much on contextualized support, contextualized learning. And as the African Union, I think I don't envy you to moderate this. You can see that we miss a forum like this. This, I think, has been initiated by MERCK. And I think most of the people that have commented, they have requested MERCK to move on. But I'm saying, I think as Africans, as African countries, as African Union, why are we united? Because we want to move the agenda forward together. So we need to come up with champions in particular areas and move forward together.
Also, which goes with the agenda of 2030, is the continuous professional development. Where we are from the continuous professional development. We always in Egypt ask ourselves about that. We always, in cooperation between the Ministries of Higher Education and Ministry of Education, in making this continuous professional development goes to all people. So we make ongoing lifelong learning. So when the teachers are graduated, no communication is there? No, we have communication with them. So the schools of education provide for them continuous professional development. So help them to be adapted with what is new.
In order for us to move forward with research and funding research, are we ourselves at the political level convinced that research is important? Because that should be the starting point. Where we are convinced that research is important, then we should be able to provide that political support. And also, with the political support, put that support into action by providing the necessary funding.